There is a new controversy brewing over whether people who've already had coronavirus should get the COVID-19 vaccine.
A new study suggests they might not benefit from it, and the medical world is appalled by this. Health reporter Haley Hernandez joining us now to put these new claims through our trust index. Haley?
So this is exactly what makes the pandemic so confusing, because that is the opposite of what local researchers down here are saying. So I went back to all of the sources from UTMB, Baylor, Memorial Hermann, and the Cleveland Clinic for a round and round in our trust index to uncover the truth. During the pandemic, walls of the med center came down as hospitals worked together to stop coronavirus. And united they stand today against a small study from Cleveland Clinic, where doctors say people with a previous infection of COVID won't benefit from the vaccine. Local researchers Dr. Piyang Shi from UTMB, Dr. Maculoso Davidson from Memorial Hermann, and Dr. Robert Atmar from Baylor College of Medicine all disagree. They say the biggest reason someone should get a COVID vaccine is because it protects from a variety of variants. And according to the Trust Index, that's true.
A really nice level of efficacy against the UK and the South African strain, which are kind of the most common.
To understand why they're not on the same page, you have to dive below the surface. For example, in the Cleveland Clinic study, they were looking at their employees who had previous infection and were unvaccinated and concluded they were not at high risk for reinfection. According to our Trust Index, be careful with this. Local experts say medical workers don't represent the general public since they're regularly wearing PPE.
Our masks, our gloves, our gowns, the risks of our exposure has decreased significantly.
It might seem as if the study is telling some people they don't need a vaccine, but the brains of the study themselves say this is false. They encourage everyone to get vaccinated, suggesting this simply offers guidance on who to prioritize. The Cleveland Clinic sent me this statement that reads, "This information could help guide vaccination efforts should there be a shortage of vaccine supply and in countries where vaccine supply is limited." Now, the study also added that this study was conducted in a population that was younger and healthier than the general population. The one thing that everyone I spoke with agrees on, the virus is still new to scientific study, and we do not know how long the immune system will protect itself against reinfection. Keith?
All right, Haley, thank you for clearing that up. We are tracking ICU hospitalizations in Southeast Texas. You're looking at a map of the 20